In this video, we are diving into therapeutic approaches for neurological and developmental conditions. There are 9 approaches that we will be talking about in this video. By the way, we also have a video on schools of manual therapy that also follows a similar format, so do check it out. Let's start with Bobath. The Bobath approach, also known as neurodevelopmental treatment, relies on normal postural reflexes as the foundation for skilled motor performance, using therapeutic handling to facilitate typical movements while inhibiting abnormal patterns. A key idea in Bobath concept is that good movement depends on posture, balance, sensation, and cognition together. Bobath therapy looks at the person as a whole, not just one weak or affected limb as we see in stroke. It recognizes that brain or nerve damage affects everything from posture, movement, sensation to thinking and perception. The treatment focuses on helping the person move in a more normal and efficient way while reducing abnormal or compensatory movements. It also considers the person's life experience before and after the injury, as this influences how they move and learn. The Roods approach is based on reflex hierarchical model of central nervous system. It proposes that normal motor patterns develop from primitive reflexes through the application of specific sensory stimuli to appropriate sensory receptors, following a normal developmental sequence to improve motor performance. The key principles in Roods approach include normalization of muscle tone, use of ontogenic or developmental sequence, emphasis on purposeful movement, and improvement of function through repetition and practice. Then we have PNF, Proprioceptive Neuromuscular Facilitation, that aims to enhance muscle activation by stimulating proprioceptors like muscle spindles and Golgi tendon organs, along with other sensory inputs like tactile, visual, and verbal cues. These additional stimuli are emphasized in the early or cognitive phase of motor learning and are gradually reduced as the individual gains skill and control. For a detailed video on PNF, click the link given above. PNF works by using neurophysiological mechanisms that allows muscle to be facilitated, inhibited, relaxed, or strengthened. This effect occurs through principles of spatial summation, temporal summation, and reciprocal inhibition, which helps improve coordinated and efficient movement. Constraint Induced Movement Therapy, or CIMT, is a neuro rehabilitation approach primarily used after stroke to improve motor function of the affected limb, especially the upper extremity. It is based on restricting the use of the unaffected or the healthy limb while intensively training the affected limb through repetitive task oriented practice. Through this approach, we are trying to overcome learned non use, and we have to enhance functional recovery and promote the transfer of motor gains from the clinical setting to real life activities. So the principles are constraint of the unaffected limb, intensive repetitive task oriented training of the affected limb, behavioral techniques or transfer package so that the gains can be taken into daily life. Therapy includes intensive shaping sessions. These are therapist guided approximations of tasks, massed task practice, that is up to 6 plus hours daily for 2 to 3 weeks, and motivational techniques like feedback to boost compliance and real world application. Now we have Brunnstorm. It is a neuro-rehabilitative method used primarily for stroke recovery and other upper motor neuron lesions. It focuses on harnessing spasticity and synergies to progress motor function. The recovery follows a very predictable sequence of 6 or 7 stages. Like given in this table, stage 1 is flaccid paralysis, stage 2 is movements in synergy pattern and emergence of spasticity. Stage 3 is voluntary synergy movements, producing movement across joints, and increase spasticity. Stage 4 is voluntary movements outside of synergy pattern. Now we have decreasing spasticity. Stage 5 is developing control of individual or isolated movement. Stage 6 is return to near normal motor control. Here is another table, although it's the same thing, but the terms here are a bit of layman. For example, the first one, flaccidity. The muscles aren't able to move and they might feel limp and floppy. So you get the idea. And here, the seventh stage, normal function returns, is also described. Although it doesn't necessarily happen, but we can expect it by stage 6, that's near normal function returns. So here's another one. Again the same thing, but now it's presented in a graph. So basically visualization is better than memorizing. And in the graph we have increasing spasticity against increasing motor control. So it's much more easy to remember. You can see initially there's plasticity and zero spasticity, then spasticity appears, there is the peak of spasticity, then it will decrease and complex movement combinations appear, and then we have coordinated movement. So this is a great way to remember Brunnstorm stages of stroke recovery. The links to the original images are given below each image, so you can go and further check it out. So we were on Brunnstorm. The therapists encourage available movements using associated reactions, sensory stimulation, functional tasks in sequence, building strength, stretching tight muscles, integrating into ADLs for independence. Comment below if you want a video on associated reactions. So we move on to sensory integration approach. It is a therapy primarily used in occupational therapy to help individuals, especially children with developmental disorders like autism or sensory processing disorder. The theory behind it is that brain integrates sensory information from tactile, vestibular, proprioceptive, auditory and visual systems to produce adaptive responses for learning, behavior and motor control. Here we have an image that talks about how sensations are integrated, meaning how nervous system organizes sensory input into purposeful action. So we have the limbic system here, which is involved in emotional processing and sensory integration. Vestibular system processes body movement and spatial orientation. Proprioceptive system processes muscle and joint input from body awareness. Our hypothesis says that vestibular system influences sensory responses and visual input. Over responses or under responses, when the sensations are not integrated, happen when tactile and vestibular input affect emotional and behavioral responses. Amygdala has a key role in sensory integration, sensory registration, and emotional association. Next, we have Vojta Therapy or Vojta Therapy. It is a neurophysiological approach that aims to modify central motor control mechanisms that influence motor behavior. It is based on the principles of developmental kinesiology and principles of reflex locomotion. I do have a video on the exact same topic, so do check it out. The key to Vojta therapy is that these reflex movements are not consciously controlled by the patient. Instead, they are triggered automatically by external stimuli provided by the therapist. So even in motor impairment, you can expect some of the movements to happen when they are triggered. The process happens like this. The therapist applies light pressure to specific zones. Reflex creeping and rolling patterns are activated. Resistance is applied to enhance muscle activation. Caregivers are also trained to perform exercises at home, and there will be practice of exercises at home, and we follow this cycle. I might sound in a rush, but then we have to complete 9 approaches along with their definition, mechanism, where they are used, principles, and all that under 20 minutes. So please bear with me. So we have motor relearning approach. It is a rehabilitation approach mainly used for people after stroke. It emphasizes task specific practice, meaning patients practice the exact movement they need in real life. So then it will be personalized, individualized, like that. Based on distributed motor control model, which means movement control is shared across the nervous system rather than controlled in a strict top down hierarchical manner. So, a question for you: which approach uses hierarchical manner? Comment down below. So, the functional activities that we focus on in motor relearning approach are upper limb function, orofacial function, sitting up from supine, sitting balance, standing up and sitting down, standing, and walking. There are 4 steps involved in it. First, the task analysis, breaking down the movement into key components. Practice missing components, focusing on weak or poorly controlled part of the movement. Practice whole task, combining all movements into a full movement. Transfer of training, practicing the movement in real life situation. Active movement control is encouraged through verbal instructions, demonstration, manual guidance. Facilitation techniques are used less compared to other neurophysiotherapy approaches. Contemporary task oriented approach. The task oriented approach is a modern neuro rehabilitation approach that focuses on training meaningful real life tasks to improve function in individuals with neurological conditions, example stroke, traumatic brain injury, spinal cord injury, Parkinson's disease. It is grounded in motor learning, systems theory, and neuroplasticity rather than reflex or hierarchical CNS model. Now we know motor learning theory, we know neuroplasticity. Let's look at what's systems theory. Movement emerges from interaction between the person, the task, and the environment. This means movement is not controlled by one part of the brain alone, but multiple systems work together. Here's how we train. There's task specific training, there's active problem solving. High repetition and intensity are used to strengthen neural pathways. There is variability of practice, that means tasks are practiced in different environments and conditions. Context specific learning happens, and there is use of feedback, initially more, gradually reduced to promote independence. So we are completed with the 9 approaches. It was a brief overview of all the 9, and I understand that it's still confusing. So I have a summary table with one statement defining all the 9 approaches for neurological and developmental disorders. Starting with Bobath. Normal movement emerges from efficient postural control and selective movement. Roods. Motor control develops from primitive reflexes and sensory input. PNF. Human movement is facilitated through diagonal and spiral patterns that resemble functional activity. Here's a question for you. Find out a functional activity that resembles T2 extension in upper limb. Let's continue. CIMT. Recovery occurs when the affected limb is forced to be used intensively and repeatedly. Brunnstorm. Motor recovery after stroke occurs in predictable stages. Sensory integration approach. Learning and behavior depend on the ability to integrate sensory input. 3 more to go. Vojta Therapy. Normal movement patterns are inborn and can be activated reflexively. Motor relearning approach. Motor recovery occurs through practice of meaningful task-specific movements. Contemporary task-oriented approach. Functional movement improves best when real-life tasks are practiced in real context. So that's all on this video. Here are the references and some more references. They are available on the description below. Thanks for watching. Like, share and subscribe.